Now this is a center which is in the heart of the city. But what we do here, we give them a wonderful counseling to rehabilitate them as soon as possible, so they don't experience and feel like patients all their lives. We have rehabilitation center where an exercise is tailor-made to a particular patient. Like for example, somebody has severe arthritis, somebody is extremely obese, somebody has had multiple heart attacks and his heart is not functioning to its fullest capacity. Can you put all these people together and advise them an exercise? No, you can't. You have to individualize the exercise. And how do you do that? There are multiple factors which come into play, which are taken into account. We have a very good dietetic counseling team. While advising a diet to a patient with cardiological problem, there are so many things to be taken into account. It's not just one particular diet pattern in everybody. Somebody has hyperuricemia, which means uric acid levels are high. Somebody has a kidney problem, and which is quite common in people who have diabetes, heart problems. So once again, the dietetic counseling also has to be one-to-one and has to be completely tailor-made. We conduct seminars and lectures in our lecture hall, where we conduct seminars not only for the peer groups, but we conduct seminars for general practitioners, physicians, students in cardiology. The other aspects of Hardas Heart Care are the diagnostic facility. We have state-of-art echocardiography machine, state-of-art exercise stress testing, 24 hours ambulatory blood pressure recording, a Holler monitoring, we have some of the bedside biochemical tests like HSCRP detection, like NT-proBNP, and stat lipid profile and blood sugars. Because sometimes these are very, very imperative and important to take a decision about the patient, and we can't wait for 24 hours, 48 hours to be able to get these reports.
It's his vision that he had to set up a practice like this, where everything will be at one stop. He in fact always had this in mind, that he should also have an in-house pharmacy, because the cardiac drugs sometimes are not available. They come from remote places, and definitely the medicines sometimes are not available. So just for sheer convenience of his patients, he wanted a setup like this.
We have separate counselors dealing with separate diseases and disorders. We have multiple models with the help of which we actually explain the patients. God has given me this responsibility to be able to make a difference in this society, but it cannot be me alone. It must be everyone in the team who comes together, who helps me to make a difference that I want to make.